members of the media and all our viewers live on TTT, on Tobago Channel 5, live on the Division of Health, Wellness and Family Development's Facebook page. My name is Rian George. It is indeed my pleasure to moderate this afternoon's media briefing. We are here, as we all know, Tobago has recorded its second positive case for COVID-19, and we are aware, we have seen all the different comments in social media land. Persons have been talking about it around town, so we are just here to further update persons on the fact that we have this second case, and to really reassure persons that things are in control in Tobago where dealing with COVID-19 is concerned. At this time, I will introduce our panel. At the center, we have Councillor Tracy Davidson Celestin. She is the Secretary of Health, Wellness and Family Development. To her right, we have Dr. Victor Wheeler. He is the Acting Medical Chief of Staff at the Tobago Regional Health Authority, specifically the Scarborough General Hospital. And to the Secretary's left, we have Dr. Ian Sammy. He's the Head of the Accident and Emergency Department. So at this time, I will invite Councillor Tracy Davidson Celestin to address members of the public.
Thank you very much, Mr. George, and good afternoon to the listening public, and of course to you, the members of the media, who have been ensuring that we share lively updates with our residents, both in Tobago and Trinidad and Tobago. And so I am here to bring you an update on a situation which would have occurred very recently. We have received the results from CAFA for one of our health workers who have since tested positive for COVID-19. The individual and his family have since been isolated and are being closely monitored at this time. The individual would have shown flu-like symptoms, and as per the established protocol, was swabbed and tested. At our meeting very early this morning, we determined several courses of actions, which includes 1, meeting with all staff to provide information on the particular situation and to provide any necessary psychological support. 2, deep sanitization of the affected areas and to ensure that there is regular cleaning at the facility. 3, contact tracing, which is identifying all persons who may have come into contact with the infected individual. I am informed that, as per established practice, especially in situations like this one, personal protective equipment or PPEs of both gloves and masks were worn. In the case of PPEs for members of staff, I am informed by both the Medical Chief of Staff and the Specialist Medical Officer, Dr. Ian Sammy, that PPEs are deployed based on the nature of the job to be undertaken. And I have been given the assurance by all doctors attached to the COVID task force and to this particular circumstance that all of the PPEs are appropriate for our task at hand. There has been the call as well to widen testing to persons who don't show any symptoms, but what has been said by the medical expert is that the test will return negative and may give a false sense of comfort. And I've been advised as well, that the test is less accurate and will return false negative. I want to emphasize to the public, I want to emphasize to all our healthcare workers that they are a priority in this particular instance, and I wish to give to them all the assurance that all is being done to ensure that they are all safe. I know that there are concerns, but our very capable doctors have been meeting with them, allaying the fears and addressing all questions that they may have. But as indicated earlier in our presentations, we as individuals, and I cannot overemphasize this point enough, have a personal duty of care and of course a responsibility to ensure that the rules and regulations as it pertains to COVID are followed as much as is possible. The hospital remains functional. However, we have reduced outpatient services, as would have been communicated to you, members of the public, sometime last week. I want to emphasize that to date, 15 tests would have been submitted to CARFA on our behalf here, and only 2 of those tests have since returned positive. And once again, I make the call, I make the appeal. If there are any persons in your communities that you know who would have had a recent travel history, if there are any persons in your communities who have or are exhibiting flu-like symptoms, please identify them. Ask them to call our hotline, which is toll-free, 800-HEAL or 800-4325.
So at this time, we will entertain questions from members of the media. We ask at this time, we are focusing our questions on COVID-19. We do know that there are several issues out there, but please, we are trying to focus it on COVID-19. So the floor is now open.
Okay. In terms of the COVID-19 case, is this person, I know you were more specific in the first case for Tobago, but in this second case, is the person from Trinidad or Tobago?
The individual is from Tobago.
Tobago. Also, sorry about that. Was the health worker still at work at the point in time when he or she tested positive? It's a female or a male?
Let me just interject as well. We nationally, and the Minister of Health has said it, due to patient confidentiality, we're trying our best to not be intrusive on the patient's identity. So let that be a guide going forward, please. Dr. Sami.
Okay.
What we have done within the emergency department is instituted something called individual monitoring, so that members of staff are asked to monitor and self-report any symptoms of flu, including fever, on an ongoing basis. With that in mind, the individual developed a fever and reported that to us. And although they had arrived for their shift, was sent home. So the individual did not engage in care of any patients at that time. And I have to say the monitoring process, the self-monitoring process, was effective in that they identified that they were not feeling well, and we were able to send them home.
Did this individual indicate at all that they had a recent travel history?
I really don't want to get into details about that. However, we don't have a travel history on the patient.
Okay. Was a travel history asked of the patient?
Yes.
That
is part of the routine questioning, yes.
And what exactly was said? Yes or no?
I am not going to get into that.
Yes.
Okay.
Moving on.
What I wanted to know also is, in terms of other healthcare workers that might have reached this particular worker before this worker complained of feeling unwell, are they also in quarantine, and were samples also taken from them?
So again, going back to the protocol set out by the Ministry of Health, and which follow international guidelines, our mainstay in monitoring our healthcare workers is self-monitoring and reporting then appropriate action. So a few things happened when this patient started to show symptoms. The patient reported it and actually had a mask on. For those people who may have come to hospital with similar symptoms, they should know that for all patients who present with symptoms, we give them a mask. So other patients who come in with cough, cold, and flu-like symptoms, we give them a mask, and that is to help prevent them spreading any flu to other people. Well, this healthcare worker, having arrived and realized symptoms had started to develop, put a mask on.
So is it that this healthcare worker was at the accident and emergency section, and is this section now shut down? Similar to what happened in Trinidad, where Police Commissioner Gary Griffith would have shut down a total police station because someone tested positive.
So, as I said, the patient, when they arrived to the emergency department, recognized their symptoms, took the appropriate preventive action, and was then dealt with and sent to isolation. What we have done subsequent to that is, as a matter of precaution really, we have sanitized the department, and we have also had a meeting with staff just to debrief them and to re-emphasize some of the practices I was telling you about earlier.
Mm-hmm. Okay, what I wanted to know also is, I don't know if it was said before, is it that family members of this particular positive case, are they also in quarantine?
I really feel that we
Yes, they are. They are,
Also,
as I would have indicated earlier. And that is the responsibility of Dr. Hoyt and her team. That is the CMOH. And they have been actively monitoring and taking control of that particular situation.
I know previously when we asked questions about the necessary PPEs, Dr. Wheeler and also the Madam Health Secretary, you would have indicated that not all healthcare workers will receive PPEs, only the frontline persons. So is it that all healthcare workers will now have PPEs to just prevent any spread at all?
Right. No, the use of PPE is depending on your likelihood of exposure. So when persons in the performance of their duties are likely to be in touch with a patient who is high risk, the appropriate PPE for that situation will be used. It's really not practical to have persons with PPEs in their pockets walking around, because then that becomes an unnecessary consumption of the PPEs. If you're working in an area where there's no likelihood of exposure to a person who may have COVID, then you are not likely to have PPEs. When you have, so for example, the accident and emergency department is the flu season, so you might have persons coming there with flu-like illnesses, yes, you would have PPEs appropriate for that. But if you're in a department, for example, in mental health, or one of those other areas where you're not seeing persons with flu-like symptoms, then it wouldn't be appropriate to have PPEs. And then the type of PPEs depends on what you're actually going to do. So if you're in the anesthetic department where you have to intubate a patient who is high risk, then the level of PPE used then would be much more extensive as opposed to just someone who's driving an ambulance with a person in the back.
Just one final question. So we have received word at TV6 that the hospital administrator has resigned with immediate effect. Any word or comments on this?
So as we said, we are going to be treating specifically with COVID-19, so there are other issues out there, but we're not here to treat with that, just strictly COVID-19.
In light of COVID-19 and the hospital administrator resigning, it's the hospital administrator.
Yes, I would answer that to say the hospital administrator has since resigned. The CEO, the chief medical, the chairman of the board and I have since spoken about that resignation, and systems have been put in place to deal with any fallout, any shortcomings that is likely to appear within the system.
Thank you so much.
Before you leave, I'd just like to address a little bit further the discussion about PPEs.
Okay.
I just want to make a point that the rational use of PPEs, that is, using what is appropriate for the situation, goes beyond just talking about resources. It is beyond saying, well, we have a limited supply of this, so we want to use it carefully. Because of the nature of the PPEs, for example, the masks we use, if they are used inappropriately, they do not confer any additional safety to staff or patients. And in some circumstances, they can actually make the situation worse. So inappropriate use of PPEs actually, paradoxically, can actually put you at an increased risk of getting infections because they're being used inappropriately. So I just wanted to make the point, it's not just about resources, it's about trying to teach people when to use it, where to use it, so we get the maximum safety benefit from it.
Thank you so much, Dr. Sami. What I wanted to know also, as you spoke of that, is some citizens or residents, in Tobago are looking at, are stating, why is it that when someone exhibits flu-like symptoms that person is taken to the Scarborough General Hospital? Is it that another facility that person can check into than coming straight to the hospital or being treated there initially?
We, that's a really good question, actually. So this is a developing situation, and it's developing relatively quickly. If we cast our minds back, let's say 10 days, a week or 10 days. In fact, at that point, we were still talking about no local transmission. And in fact, actually, I think if we go back even 10 days, we were talking about very small numbers of even imported cases. I think that was still when we were like in single figures and that sort of thing. So if you could just imagine, in that situation, setting up large-scale systems then may have been premature. However, we do recognize that getting everybody into the hospital can, as numbers increase, be counterproductive. So there are things going on to reduce that. We heard about the hotline. The hotline went live this week. Our staff deals with calls from the evening hours, and we have been getting calls, and it has allowed us to give people advice based on what they tell us to avoid them coming to hospital. We have been, as part of a plan, initiating a system whereby we will have a temporary facility just outside of the emergency department to assess flu victims. Again, we had to time that carefully because it would have not made sense to do that when we were getting 1 or 2 people with a cold every day or 2 days. Now that we see that things are increasing, the tent is up, we are making the final preparations to bring it on stream so that at least patients with flu-like symptoms, it's easier to separate them from the general patient population if they have their own facility. And thirdly, a similar initiative is happening in the community. So one of our health centers is being developed to have a similar outside facility to cater for that, for exactly the reasons you said. We're trying to not have all flu patients come to the hospital.
And that is why, Dr. Sami, similar to the press releases that we have been receiving from the Ministry of Health. Specifically, what has been indicated on those press releases indicate whether a case was imported or not. The minister has gone into detail as to say these are the cases from the cruise ship, etc.
Yes.
So that is why I would have asked before, which was not answered, with respect to if this person, if this second, the positive person, has a travel history or not.
Yes.
I think it's
So-
necessary that we should know.
I agree with you. I just want to make a point. I don't know if it's a little bit more complicated when you're dealing with a healthcare worker, just the contact tracing alone. I mean, because of the way we work and who we're working with. The reason nothing is said so far is because the contact tracing is actively being pursued. The one thing that I don't think, I'm talking for my public health colleagues now, but one thing I'm sure they don't want to do is say one thing now and then come back tomorrow and say, you know what, we have to change what we just said. So I know it's a little frustrating for the public, but we really have to exercise due diligence with our contact tracing before we make a pronouncement about what this is.
Okay, thank you.
You're welcome.
Thank you. Other members of the media, you have the opportunity to ask your questions.
Hi, good afternoon. Food Next to 91.9. Just coming on the heels of that particular question with the meeting of office of that person at the hospital. Has the hospital staff been able to cope with this particular COVID-19 response? And have we been getting the relevant effort and output from the staff? Or have we seen staff shying away from working on COVID-19 patients or working in the field where they may be put at risk?
All right, so the first positive patient we had was dealt with in the accident and emergency department. And what happens after a situation like that, staff are usually counseled about the experience, about the appropriate use of PPE. There's been extensive training which is ongoing about the use of PPE, how you put on PPE, use of the hazmat suits. But in spite of that, persons obviously would be concerned and in some cases a little fearful. So that is why in various departments you would have the reassurance of the heads of department, accident and emergency department, which is like a frontline department. With Dr. Sami as the SMO, there's ongoing discussion, reassurance of the staff about their concerns. The aim of all of this is a new experience for us. We've dealt with suspected cases successfully. Staff have been counseled after. We now have 2 patients who are positive. Staff have been counseled. The systems that we have in place to dealing with this have been tested and have worked so far. Naturally, because it's new, persons would be apprehensive. They would see changes taking place to various aspects of the hospital as we ramp up our preparation to deal with it. Remember, this is an ongoing, developing public health concerns that has affected how the hospital operates. The outpatient clinics are affected. You have nationally non-essential services being affected. So it's a general ongoing adjustment that we are doing. But so far, what we have put in place to deal with it has been effective, and we adapt to whatever situation that presents itself. That is why we have regular meetings to develop, adjust plans that we initially have in place that evolves, and we just deal with it as the situation presents itself.
I'd just like to make a couple of comments. The first is to say, so there's nothing about what we're doing that we would claim is perfect. This is new to us. And as heads of department, we are grappling with what is the best thing to do, and that sometimes changes day to day. However, I want to assure you that the primary care arm of your health service, public health, and hospital care in the guise of the emergency department. We have been working as closely as we can. We pretty much talk to each other every day to try to keep a coordinated response. Like I said, it's not perfect. We are fighting with something that is new to us. So I just want to make that point. But the other point I really have to make is my staff in the emergency department are the frontline staff. I will tell you that from the beginning of this, I'm not going to say they, I'm going to say we have all been anxious and somewhat afraid of what may be developing, both for our patients and also for ourselves. But I can tell you that to date, I have not had a single staff member in my department refuse to do their job. We give them the opportunity to express their concerns. We have regular meetings and we let them say what they have to say, and we take it very seriously. And actually often their concerns help to mold how we do things. But I just have to say, my staff, and I'm not just talking about doctors, I'm talking about doctors or nurses, the attendants, the clerical staff. They show up to work, they do their job, they will tell you how afraid they are, they will tell you when they think that maybe what we're doing might put them at risk or might be not best for the patient. But at the end of the day, they go out, just to say, today we had to break this news to them. And you could imagine what that meant to them, to tell them a colleague got this thing. They listened, we spoke. I think we must have spoken for about an hour and a half. And at the end of that time, so we have them, like the ones who are home, they will use electronic media to join the meeting. And the ones who are there, they stop what they're doing so we could talk. And at the end of that meeting, without half a second of hesitation of us, they all went back to their job.
Thank you. And just to move forward, with respect to transmission of the virus, I guess we cannot say definitively whether this new patient is imported or a primary contact transmission. We cannot say that at this point. Am I right? No. All right. In that particular respect, then, how has the research spoken to transmission before symptoms have begun to show? Is there a possibility that COVID-19 could be transmitted from one person to the next before they show symptoms?
So there is a possibility. This is a virus that we don't know that much about. The epidemiological data suggests that the most active time of transmission is when patients are symptomatic. That, of course, gives us a little bit of a quandary. Because before they become symptomatic, people wouldn't know. But so far, what we know about the virus is that if transmission does occur during that time period, it is not as likely as when people are symptomatic. And it seems as though the period before you become symptomatic, that in which you are infective, is not very long. Some people talk about 2 days. Actually, when you read the literature, the most likely time is probably just a few hours before you show symptoms. The most likely time for you to spread the virus, before you become fully infective.
All right. Finally, I just want to address a situation that I've been looking at. I know a number of times the Secretary has asked, Dr. Hoyt has asked that if you do know someone in your community that may be displaying symptoms or who may have had a recent travel history, that you encourage them, of course, to take the right steps and move forward. This particular call, I think, has raised a flag in my mind in terms of how many people may have slipped through the cracks. How many people, do you all have a number? Is there an idea in your mind how many may have slipped through? Because I'm thinking with 20,000 people coming into the country in 3 days, some of them may have landed in Piarco, and then come across to Tobago and may have slipped through. Because I know in one instance, I spoke to a young lady who was in quarantine, and she said, she had to declare that she did take the travel, and she was honest about it. But it left a gap there where some people could not say, and they could end up in the community. Do we have an idea what that number looks like? Can we even, and it's a scary situation, I know, but I don't know how else to address it, so I'm trying to find out if we have a handle on that.
So the problem about answering that with great authority is the public health people are not here.
Yes.
I think I wouldn't be out of line to say people have slipped through the cracks, as you put it. We don't know how many. One of the things, so we man the hotline, and one of the things that we have found, not a lot of people, but we have had maybe 1 or 2 calls from people just to call and tell us, I am one of those people you don't know about. I am self-isolating. What else should I do? And then, of course, we ask them about symptoms and so on, and then we could give them advice. The only reason I say this is because if you think about the situation, that contingency is very likely. We have to depend on people being honest with us. And actually, I just want to use the opportunity to appeal to the public to be honest with us and to be responsible, so that not only will you protect others, but you will also protect yourself and your own loved ones.
All right, thank you very much.
Thanks, Vern. Akin?
All right.
Good afternoon, Akin Abihola, Channel 5 News. I just want to go back to the second positive patient, just to clear up something. You said that the patient said they had no recent travel history, right? Am I correct?
So, I don't think I answered. I did?
You did.
All right. Oh, yeah. Okay, sorry. I'm sorry.
Okay.
Yeah. The patient did not have a travel history, yes.
Did the patient say whether they came into contact with someone with a recent travel history?
Okay, so that is why we're being so hedgy about this. That is happening right now. It's not, I know it sounds like it should be just, well, did they ask a question and what did they say? But actually, what is happening now with the public health people is that they are exploring that in real detail. And that's why I said with healthcare professionals, it's a bit more difficult. If you think about a doctor or a nurse seeing patients, they might not know. But what the public health people are doing now is trying to track down who these people are, and then to dig into their past to find out what the patient may not have known at the time. That's why we've been so hedgy about.
Okay, so the reason I'm asking is because persons who are listening now, they a bit confused as to how you could not know whether he traveled or not traveled, or if he came into contact with. So just to give persons a bit more insight into.
Yeah, so he on several occasions, he has been asked about travel, and actually because this is somebody working within the system, we are reassured that he didn't travel because he was at work. That is one half of the equation. The other half that we can't answer is the contacts, because the person themselves may not know, and that is what is going on right now.
Okay, so apart from imported cases, the only other 2 classifications of contracting the virus is community spread and primary spread. Am I correct?
Yes.
Okay, so it's just a determination of which it would be.
Yeah, that's fair enough. Yeah. So we know this is not an imported case. So what is trying to be teased out is whether it's a primary contact or it's community spread.
Okay, one last question. Does the health official have a private practice?
I don't know, and I'm not going to go into those details.
Thank you very much, Akin.
Okay, thank you.
We just have one online question that came in, which I will pose to the panel. What is the plan if Tobago ends up moving from a trickle to a dump in terms of caring for confirmed cases? Basically, if we have the numbers get increased to such a point?
Well, what we have is we have a facility where if persons are positive and well, we have an isolation facility to have those persons observed. The plan is if the person is positive and ill, we will transfer them to Trinidad where they are the established health facilities to deal with persons who are positive and ill. And this decision is, because remember Tobago is part of Trinidad and Tobago, and part of the national response to this problem is to have centers dedicated to only treating persons who are ill with COVID. And as Tobago does not have a facility to treat with persons who are ill with COVID, we will transfer them to Trinidad.
All right. Thank you, Dr. Wheeler. One last person to ask questions, Cassandra.
Good afternoon, everybody. Cassandra Thompson, Forbes Guardian Media. To the panel, patient number 2. Has that patient been in contact with the first person who tested positive for COVID-19?
No.
Okay. A question that has been circulating a lot. I'm not sure if it's regional or international precedents, but these frontline healthcare workers who are dealing with this situation, are they getting some sort of hazard allowance on a separate form of payment because they are indeed putting themselves at risk?
Dr. Wheeler?
Well, no, that's not part of the terms and conditions that we have. And I don't know that it's something that would be something that may be the union, because the healthcare workers are represented by a union, and I've not seen that come up as a separate issue. Remember, this is a flu season that we are in. And normally in the flu season, we have persons who are at risk for flu, and we have protocols for dealing with that. And I think persons should remember that influenza, which we still have, has killed over 40 persons in Trinidad and Tobago at present time. So even though the focus is now on COVID, we should still remember that influenza is still something that is out there. We've had SARS, we've had various epidemics over the years, and I have not in my time heard anyone raise that issue of a hazard allowance.
Mrs. Davison Celestine, in prior press conferences, you indicated that there would be an augmentation or an increase of staff coming out of this situation. Can you give us an idea of the amount of persons, nurses or doctors that has been brought on staff?
Well, each unit would have requested nurses and some doctors to augment what they have been doing. I know Dr. Wheeler would have made a request for about 9 doctors and several nurses, I think about 16 or so. And we have since contracted those persons on a short-term basis.
And just to add, we have had 3 doctors who have come on staff within the past, 2 additional doctors who have come on staff within the past 2 weeks, and 15 nurses that should have started this week. So all of this is our efforts to ramp up our human resource capacity in a time when we may have increased demands on the service. And it's also part of the ongoing efforts to, we have persons who on an annual basis would be coming on and leaving, so it's just a normal recruitment process that has actually ramped up because of COVID preparation over the past couple of weeks.
Going back to patient number 2, how many members of staff are currently in isolation coming out from that contact with patient number 2?
So the national guidelines, which are based on guidelines from the CDC and from the UK, actually don't recommend isolation of asymptomatic staff. What we recommend is what we call self-monitoring, which is ongoing. that is reinforced by what I said about that patient's self-monitoring. So although patients, other staff were exposed to him, the person was wearing a mask and identified that he may not have been well early on at that shift. So that helped to minimize the amount of contact. But really what we do is the self-monitoring, which all the staff in the emergency department are currently doing. And actually that started earlier this week.
So they are self-monitoring, and so they are not coming to work?
They are coming to work. And that is, right now, those are the guidelines we are working with that are national guidelines and based on guidelines from the UK and from the United States.
Cassandra, any other questions, please?
I do.
Trying to wrap up soon.
Coming out of yesterday's press conference, other RHAs, their allocation was made public. Can you tell us how much money did the RHA get from central government to fight COVID-19?
Well, in terms of the budget for COVID, we have been having discussions with the Secretary of Finance, who will make representation to the national arrangement for funding for treating with COVID. And as the details come to hand, we will provide the public with the information.
My final question, and this is in relation, just going back to the situation with patient number 2. You're saying that members of staff who patient number 2 came in contact with, they are currently working. Many would feel that they might be at risk because they might be asymptomatic at this time. What kind of assurances can you give the people of Tobago? Because their persons would be going to the hospital, would be going to A&E, and would be coming in contact with this individual. How likely is it that somebody might be coming in contact with a nurse that might be asymptomatic?
So let me just make 2 points. One is that, as I said, this patient identified that they were symptomatic when they arrived. They put a mask on. They stayed out of the clinical area. They stayed because they had to be tested ready, and then they went home. What we have looked at is people who he has been in contact with in the broadest sense. In other words, you're on a shift, these other people are on the shift. This is not something that we decided on our own. This, as I said, is national policy, and even so, when this happened, we had extensive discussions with the unit in Trinidad that is in overall control of this. And the advice that we were given is what we are doing, which is self-monitoring and reporting of symptoms, but people do remain at work.
And my final question, normally we have been asking this question since the inception. The government is saying we have over 1 million masks available and the number of PPEs available. How much PPE is available at the TRHA?
We have enough PPEs in stock, and as I would have indicated, as the need arises, as the demand increases, we request PPE from the organization that is established to provide the TRHA with equipment.
Okay, thank you.
Thank you very much, Cassandra. Thank you very much to all our viewers, all our listeners. I will ask anyone who has exhibited any flu-like symptoms. We have our hotline, 800-HEAL. Ensure to call that number, 800-4325. It is toll-free, so you won't be charged for it. I want to encourage as well persons in the public, persons who have had a travel history in the past 14 days, present yourselves to be monitored. Call the office of the CMOH, 639-3751. And lastly, I want to encourage persons to practice the preventative measures that have been set out worldwide. Wash your hands, ensure to soap it up nicely for at least 20 seconds. Practice your social distancing and all the other different preventative measures. This is something that affects us all, and if we do our part, we will counteract this virus. So I want to thank you very much. It has been a pleasure at this media briefing. I do encourage all our media personnel, get home safely. Thank you very much. Have a good evening.